Good morning, everyone. We welcome you to this online session on children's dental health with Dr. Jasmine Singh. I am Nitika Seth. I am the founder of Little Amigos Early Learning Center and also the co-founder of Little Amigos Nest. And this session is being sponsored by Little Amigos Nest. Little Amigos Nest is a one-stop shopping destination for your little bundles of joy. And we at Little Amigos Nest always believe that having a baby is one of the most magical moments in one's life. And for this, to make these moments special, we have a wide assortment of baby essentials. We have collections like gift sets, toys, games, clothing, accessories, school supplies, books, baby gear, food diapers, you name it, and we have it, and many, many more. So, without much ado, I'll now welcome Dr. Jasmine Singh. Dr. Jasmine Singh also has a wonderful Instagram handle at the rate Dr. Battisi. I really love the name,
Yeah.
and we've also had Dr. Jasmine Singh earlier as well, and she has had a wonderful session with us earlier during the COVID times. So now over to Dr. Jasmine Singh. I would request Dr. Jasmine Singh to introduce herself briefly before we move on to the questions which the parents and many other people have asked us, and we'll be starting the session. So over to you, Dr. Jasmine Singh. I'll spotlight you.
Okay, ma'am. Thank you so much. So, shall I just share uh, accordingly, or you want me to just continue with the session? Shall I start?
I leave it entirely to you. You can start. I'm sure during the
Okay.
session which you are going to be
Yes.
doing, the questions would be addressed. If still anything is left behind, we'll take it in there. Okay.
Sure, ma'am. Sure. So, firstly, let's start with how to brush child's teeth properly. But the more important question is when to start it. So, jab bhi first teeth appears, which is usually at around 6 months to 8 months. Sometimes the teeth come little late, so you don't have to worry. You can wait till the first birthday. If the teeth is not out even after the first birthday, then definitely go ahead and consult a dentist. But ideally, the first dental visit should be when the first teeth is out. So once the teeth is out, you have to clean it. How? We will share. And some teeth are called neonatal teeth or natal teeth. Natal teeth are those teeth that are present during birth. So some babies are born with teeth when they have just come out of delivery. So those teeth are removed because it can hamper your feed. It can be a cumbersome thing for them. So we have to remove that teeth. And once that is done, and some teeth appear in the neonatal teeth. What is that? Which appear in the first 30 days of life, which is like the first, when the baby is turning 1 month old, that teeth appears. So these two things are neonatal teeth and natal teeth. Now comes once your feed is done. Of course, the baby is taking the feed all the day. So once you please dip a clean, soft cotton, very neat cloth in water, take it in your finger, clean finger, and just wrap it around after the feed. Now the question is, if agar aapne raat ko 12 baje you have done this. Now the baby has taken again 2 a.m. in the morning. So when to do it? You can fix the twice a day rule, like 12 baje raat ko and then afternoon again at 12, so that the gums pads are clean. Doesn't matter the baby is on just pure feed for 6 months, so the baby is not getting any sugar or anything, but the milk itself has sugars. It itself has carbohydrates. So we have to clean the gum pads. Then you have to continue doing this till 6 months. Once the teeth is out, start using a toothpaste. Many toothpaste are available. I can share the link directly with ma'am so that they can put it out in the post or would share with you on the social media handles. That toothpaste is edible. So 0 to 3 years, you can use that toothpaste. Even the packaging of that toothpaste is so good that even the child while playing is biting on it, it's again not harmful and it's again edible. So, and till 6 months, you have to do this. 6 months onward till 3 years, we will start with the brushing. Brushing, a soft brush, a kiddo's brush is available, very easy available. I prefer to use a bamboo brush even for myself, so you can opt for one, because the most plastic generation in the whole wide world, one of the top reasons is plastic toothbrushes. So once you go ahead with the kiddo's toothbrush, then you have to apply rice grain size toothpaste. जो एक चावल का दाना होता है, सिर्फ और सिर्फ उतना टूथपेस्ट you have to put it till 3 years. After 3 to probably 6 years, you have to use a pea size, मटर के दाने के जितना toothpaste size you have to put. After that, a small the toothpaste for us or for adults or above 7, 8, 9, you have to put a flat, plain single layer of toothpaste, and not that is shown in the advertisement like whole ऐसा वो design बना के जो show करता है. You don't have to put it that way, because those are advertising and they are getting huge funds for the marketing. So they are in their own way. Even there was a research that the Colgate toothpaste has opened up the toothpaste nozzle a little bigger, so that the more toothpaste comes out each time the customer uses it. So that's not good. They want their toothpaste to get over, very fast. So that is not the right thing to do. So, and next, how, because in clinic right now, I can't even share with you how many kiddos are getting pulpectomies, how many kiddos are getting fillings in their teeth. So that is not good. Because
Dr. Jasmine, um, looks like there is a glitch. Yeah, yeah. You were talking about pulpectomy, I think something like that. Yeah,
yes,
please.
yes, yes. So pulpectomy is kiddos RCT, the RCT root canal therapy that we do for adults. The same thing for kiddos is called pulpectomy, and a lot of kiddos are going ahead with that because a lot of kids are getting the RCT done. So how to avoid that is right brushing technique, right from the baby is born, swapping the gums with a clean wet cotton or cotton cloth, and then toothpaste from 6 months to 3 years and then onwards, always. So we can prevent a lot of cavities if once a year dental consultation is done, because that is so important. You can get the teeth cleaning of the kiddos, which is done by hand instruments. And once they turn a little bigger, we can do the instrument like what we use in adults, scaler or scaling, what is called as. Um, but cleaning is very important, because your toothbrush and toothpaste, no matter even you are using it for 24 hours, it will just clean 60% of your tooth surface, 60 to 65. Rest 40 to 35% is still left. So just imagine a patient, probably 40 years old, haven't got a single teeth cleaning done in all these 40 years. So that 40%, 35% for 40 years, that areas are left behind. It is not clean. And cavities, simple meaning कि जहाँ पे खाना फंसा था, जो निकल नहीं पाया due to various reasons, उस वहाँ पे the microorganisms act on the food, and the food is stuck between the teeth, so it acts on the teeth as well. Now the teeth, these teeth, the top layer is enamel, which is even the hardest substance in the whole body. So when the patient asks for guarantees of the fillings, they should not, because it's just a material at the end. Dental technology has surpassed all the inventions till now, and it's really good materials that are available right now. But even my bone of the arm, or bone of the chest, or bone of the foot, it's the enamel, the teeth enamel is stronger than that. So it's just that once you buy a car, we never ask the supplier that गारंटी दो कि इसमें कभी एक्सीडेंट नहीं होगा, गारंटी दो इसमें कभी डेंट नहीं होगा, गारंटी दो इसमें कभी टायर चेंज नहीं होगा. So same way we have to protect these teeth. Once we do one cleaning or one dental checkup a year, I can guarantee 99.9%. 0.1%, no doctor can take a guarantee of 100%, but 99.9% that you will never visit a dental clinic ever again for any particular treatment. So this saves time, money, of course, and energy, and a lot of discomfort on the patient's end. Now, there are a lot of tooth-friendly snacking options available for the kids. We just have to opt for a healthier one. In future, whenever I'm getting kids, so I'm planning that I will never give them sugary stuff, anything chocolate, nothing at all till 5 years. So even many people who we well know of, once they have kids, I just saw their interviews that instead of giving them, उनको पता ही नहीं है chocolate क्या है. If they want a chocolate, they give a kishmish, they give a khajur, they give a anjeer. So I prefer not to give them that. Secondly, healthy snacking options is a lot of companies are coming up. Maybe I just remember one, Healthy Masters, Slurp Farm, that Anushka Sharma promotes. These companies and a lot of more are available, which has beautiful ingredients, and you can cook the same at home as well. उसमें ज़्यादा cumbersome नहीं है, but the snacking should be healthy. You can use A2 milk for the kiddos. A2 milk can be turned into curd for the kiddos. A2 ghee can be given to them, if not at us, because we have already grown up to a certain age. So for them, we can use that. The washing of the fruits, especially the grapes, because they has huge pesticides and insecticides, so that can be particularly washed with baking soda, or there are many reels available where the right washing of the fruits can be done. So, and always remember, no matter बच्चे को कभी भी chocolates के लिए, sweets के लिए, toffees के लिए मना नहीं करना है after a particular age. Because I prefer 5 के ऊपर देना चाहिए, but once they turn 5, sticky food, it doesn't matter what the kiddo have. Their body is in such a way that it will be able to digest. Even we should not have it. But the only thing is, if they brush twice a day, the child or we cannot sleep us with a sweet mouth. Raat ka brush is most important than the morning brush. Morning can be skipped, but the night cannot be skipped because your mouth is closed for around 8 to 10 hours or 9 hours. And agar wahan pe khana फंस गया, the inside mouth is sweet. The microorganisms are going to act on it when we will never know. And हम बोलेंगे कि हमें तो पता ही नहीं चला कीड़ा कब क्या लग गया, because we were sleeping at that point of time. And कीड़ा ऐसे नहीं लगता है. Kira is always shows signs like it will start appearing a little discolored, white say yellowish, yellowish to brownish, brownish to blackish, it will turn, and then you will feel sensitivity, and then we ignore that sensitivity. Oh, abhi to maine kuch thanda kha liya, shayad that is why it is happening. Oh, it's winters, maybe that is why it is happening. Maybe that is the right reason, but once a dental visit once a year is a must. There are a lot of questions that patient ask, probably that agar if a dentist is not available at 2 a.m., just for example, so what can I do for teeth pain at home? The only thing at that point of time, either one or two things are there. One, you can have rinses. A glass gungunas, a little hot water, mix it with half, or maybe probably because it's a kiddos, so 2 pinches or half teaspoon of salt. For adults, it's 1 teaspoon. For kiddos, it's half teaspoon or 2-3 pinches of salt, and then do the rinses. Rinses, I'm not saying gargles, I'm just saying rinses, because that will take away the pain or manage it as well for the night. So once you do that twice or thrice a day, I'm quite sure in an emergency, the next day, because salt and pani everywhere it's easily available. So you can definitely go to your dentist for the next visit. Or you can use clove. Clove definitely, I'm not saying that wo clove काम करेगा, but it will just give a mild relieving pain. But that clove, once it's chewed on, should be removed from the mouth. यानी कि clove भी वो दांत पे ही पड़ा हुआ है. That will cause more cavity in the long run. So this, and probably अगर बहुत emergency है, just go ahead with any painkiller that your pediatrician is already giving or that you already have. Any painkiller or any painkiller syrup would do in an emergency. This is taken, all these three will take care for the 24 hours, and the next day you can definitely visit your dentist or the periodontist. Periodontist is people who are specialized in kids dentistry. So like pediatrician are there, after MBBS, we have periodontist for the same. Yes, a very interesting question we usually have, like what to do if my child resists brushing their teeth. of course, there is high chance they are going to do it because they don't know something is getting inside. They don't know how to spit it out. So definitely they're going to resist. But the brushing is only done for 2 minutes, not 5 minutes. So 30 seconds, 30 seconds, 30 seconds, 30 seconds, which makes it 1 minute up and 1 minute down. So you have to brush only for 2 minutes. And you have to make that 2 minutes a fun activity. You have to brush with them the right way. The right technique we will definitely going to share you probably a little later. So with that right brushing technique, you are, and with that fun activity, you are inculcating a habit in the kiddo that brushing is quite nice, and taking care of the teeth not only boost confidence, it's okay. It's very, you will have a good smile. You will, and more than that, you will have a very healthy, good smile, and you will have no bad breath. So you have to, and you have to spend energy for the 2 3 minutes every single day, twice a day. I mean, twice a day for 5 6 minutes, that you have to spend those 4 minutes, 2 times in the morning, 2 minutes in the morning, 2 minutes at night for the with the kiddos, so that this can be a habit for them. You can go ahead with the electric brush once the kiddos turn 3 or 4. And the right toothpaste till 3 I have shared. After 3, it should be fluoride, and then it should be fluoride till 18 years, 20 years. Ours toothpaste is non-fluoride chalega because the tooth has already formed and are erupted. But the developing stages of the tooth should always have fluoride. So other than that, you have to make sure it's a habit, and before making them a habit, you have to brush, because the children sees what the parents do. We can't just say to them कि ये करो अगर हम नहीं कर रहे हैं वो चीज. So you have to be with the child and do the brushing just 2 minutes. That makes it 4 minutes a day. And these 4 minutes whole year, and just one consultation a year with your nearby family dentist, I'm quite sure you will never visit your dentist again, and you will have a beautiful, beautiful teeth. So, and there is a very two, three common things that have that we doctors very, very commonly see is thumb sucking, mouth breathing, and pacifier use. Never use a pacifier. Never, never use a pacifier. Let them chew on things which are soft, which are silicone based, which are clean, which are sterilized, but never use a pacifier. Thumb sucking till 2 to 3, probably, or max 4 years is fine, but but if it's beyond 4 years, it's not okay. You have to visit your dentist for the same, because they do like this. So they are pushing the front teeth forward unnecessarily. A force is causing up. So we have to check. Maybe a X-ray is required, but beyond 4 years, it's not okay. Or beyond probably 3 or 4. Yes. The pacifier causes something called as pacifier bite, which is called open bite. उनके दांत ऐसे हो जाते हैं, which should be like this. So it's an open thing, and there is something called as parents worry a lot during especially 9 years to 12 years. This is a phase when दूध के दांत are going, and which are the milk tooth, deciduous tooth, and the permanent teeth, that are the adult teeth, are coming in, the permanent one. So this phase of changing, because half are milk teeth and half are permanent teeth. So in this phase, this stage, 9 to 12 years, is called ugly duckling stage, because if you remember during our childhood, or if you ask our parents or somebody who has seen us grow, would know that during this stage, no kiddo look nice. It's ugly because we don't look nice. It's duckling because the teeth are like in the duck shape. So this is a phase. The best treatment, if we have to put braces or something like that, is 9 to 15 years max. Even an adult or orthodontics is there. Even we are putting braces in a 40-year-old right now, and that is okay. But the best changes happen is between 7 years, 9 years, till 14 15 years, if you want to go ahead with the braces. So the thumb sucking, all mouth breathing, all these habits are fine to a particular age. But after that, definitely visit your dentist and share with them that this is all happening, because this is not a physician thing or a pediatrician thing. This is purely and purely dental surgeon thing. So only a dentist can take care of it, or suggest the options that can be done, or invite their team in and discuss it with their panel and share with you whatever is necessary at that point of time. Because speech problem, chewing problem, irregular teeth, crooked teeth, malaligned teeth, open bite, a lot of gaps in the teeth, all are causing this. And a lot of kiddos, maybe 6 years, 8 years, of course, they are into playing. It's always better to play rather than watching TV or digital, if it's beyond a controlled way. So, once they're playing cricket, a lot of boys come ki that आधा टूट गया. So a lot of girls are coming that have fell off. So what to do? So at that thing, if your permanent tooth has come fully out, don't wash it, just put it in a cold glass of milk and visit your dentist. There is high chance that tooth can be saved and reimplanted. Number one. Number two, don't wash it. Don't use water. Number three, night guards are something similar to mouth guards. So mouth guards are used during play. If you see the boxers, or if you see any sports person who is into running or something like that, or maybe cricket as well, they use mouth guards. So that protects the mouth and your teeth, especially. So you can get a custom made with your dentist. They will just take the impressions and a mouth guard from the lab will be made. In fact, nowadays, customized with the Spider-Man or whatever is suggested, that can be done, whatever the kiddos wants. If if you want the name on it, or other things can be done, it's highly customized. So that can be done. And any other injuries, uh, when you visit as soon as possible, in case of trauma or injury within 24 to 48 hours, it's ideal. The all things 99% can be taken care of, but don't push it beyond. No matter wherever you are, don't wait, you have to go home, you are not in your hometown, you are outside, wherever you are here in India, visit it. Visit your nearby dentist within 2 days of the trauma or injury. Um, we have talked about the crooked teeth, and the only thing I would say prioritizing is making them brushing a habit, making never sleep them with the mouth. It's fine once in a blue moon if they skip their morning brushing, but ideally they should brush at night. In the morning, have something and then brush. Maybe you are having a little breakfast or something like that, and then a brush again. That's the ideal way. Now the brushing, which would be, I think, a shocker to you, is 2 minutes brushing is clear. 1 minute up, 1 minute down, 30 seconds each side. Second, the brushing is always in up down. Suppose this is my brush, so it should be up down and circle circle. It should never be left right. Left right is a position where just I'm putting like this, so my up teeth and the surface below it is getting messed out like this. So there the cavities can happen. So left right brushing doesn't make any sense. The You have to put your lips apart and do like this and this, up down or circle circle. And the two areas where parents usually forget is, this is the brush, so you have to scoop it out and up. So every tooth surface that you can see, just 30 minutes. And bachcho mein to the teeth are only 20 in number, so they can be easily maintained. Please choose the right brushing, right toothpaste with your dentist, because there are different types. What should be ideal is ideally checked. I can share the link for the 0 to 3, but beyond 3, you have to visit your dentist and know the right toothbrush for yourself, no matter even if you're 60 years old. um, and once you have done the brushing, 30 seconds each side, then just spit out the whole content in your mouth. एक बार बस अच्छे से spit कर दो. That's it. There should be no rinsing that we usually do, because the fluoride and the important, not chemicals, but yes, at the end it's a chemical. So whatever thing, the good things the toothpaste has, it doesn't get time to work. So how will the teeth get stronger? So everything should be spit out after the brushing, but no rinsing. And then eat or drink anything after 30 minutes. That's it. Now, within 1 or 2 minutes, everything is dissolved in the mouth. So it will give you very fresh breath. Just try and do that, because maybe it will get a little time for making it a habit, but everything should be spit out and no rinsing at the end. That is how the fluoride and all the chemicals, or all the best part of a toothpaste, will give your teeth the benefit once it is on the tooth surface. So probably we have discussed all the basics. Please shoot with your questions if you have any.
Sure, Dr. Jasmine, that really covers a lot. I have a few questions with me which parents have asked. So one thing which is there
Sure.
is a myth that, like you mentioned about the root canal treatment. When it's a milk tooth, many parents think that, even if it's a cavity, it will go away because a new one's going to come and it's going to be fine. But you mentioned about root canals. So how important it is for getting a root canal treatment done when the child has.
Pulpectomies in kiddos, yeah, are very, very important because it depends which tooth it is. It depends on the X-ray. First, the three layers, enamel, dentine, and pulp. The first, enamel and dentine, if the caries has reached these two layers, the filling can be done. If it has reached beyond in the third layer, which is the pulp, the nerves that tells you that I'm feeling hot, I'm feeling cold, I'm feeling pain, I'm feeling sweet. So those nerves, once the caries has reached that layer of the tooth, then we have to definitely go ahead with the RCT in adults or pulpectomy in the kiddos. Pulpotomy is also there. We naturally save the tooth if we know that the milk tooth needs to be there, and if the teeth is coming out within like 3 months or 6 months, we suggest extraction or removal of the tooth because we know the below permanent tooth is coming up. But if there is time, 1 year, more than 6 months, 1 year, 2 years, 3 years, 4 years for the permanent tooth to come, and वो दांत में कीड़ा लग गया है to a such a level, we should save that tooth. अगर वो दांत निकलेगा, dentist is suggesting tooth removal, we will remove that tooth. We will put something called a space maintainer, because if we don't put a space maintainer, नीचे वाला दांत को जो permanent tooth है, that will not find a guide to where I have to come. So that will cause a lot of trouble because the for the permanent tooth to come, the guides are the primary teeth, the milk teeth. Once they're out too early or too late, it causes problem. So pulpectomies is a very good way to save the tooth, and if needed, uh, stainless steel crowns are put. Zirconia crowns are also there. Stainless steel are very common, and we share with the kids that you are going to have a silver tooth. No other friend is having it. You are having it. So we have to encourage it in a way. So you have to find your right dentist who with a lot of patience, because with kids the same RCT that we do in adults probably in 1 hour, with kiddos it takes around 2 to 3 hours with the crown. So it's a one sitting procedure, it's painless. हैविंग सेड दैट, अगर हम उनको एलए दे पा रहे हैं तो बच्चों को कभी भी नहीं बोलना है कि आप ये काम करो नहीं तो डॉक्टर इंजेक्शन लगा देंगे, आप ये करो नहीं तो ये सफाई करो या वट एवर, ये करो नहीं तो हम डॉक्टर के पास लेके जाएंगे, भूत आ जाएगा, वहां पे इंजेक्शन लगा देंगे. इफ यू से ऑल दीज थिंग्स, यू आर जस्ट क्रिएटिंग अ लॉट ऑफ ट्रबल फॉर योर ओन किड्स, बिकॉज वी गिव इंजेक्शंस नॉट टू पेन them. We give injections so that the pain doesn't occur to them. So that way it's very, very heavy on us. We need to have 2 3 doctors, 2 3 assistants that is helping, a lot of gifts, so that that thing can proceed smoothly. So never ever, and please don't be, a lot of message to the parents, I would say, don't be too uh, you know too careful about your kids. अरे ये दर्द कैसे सहेगी, अरे ये दर्द हो गया इसको तो it's just a tooth pain. We are just treating it. अभी तो life उनको क्या क्या दर्द देगी. We have to prepare them in a way. So don't be too careful with them. Just be there at the back end and let them be free. Let them sit on the dental chair alone so that the child learns. And if suppose you are like getting a treatment done from a dentist, take your kids with them so that they know, they are accustomed with the dental atmosphere. They are not afraid of the noises of the machine. They are not afraid of the instruments. They are not afraid of the light. They are not afraid of the air or the water that comes from the instruments. So just make them aware. If you're taking it to a game zone, take them to a dental visit as well once a year.
True, very, very important. Now, you mentioned one thing that if the tooth comes very late, it doesn't come probably in the right position, because that is another thing which I see a lot in many children, that the permanent tooth doesn't come out and the milk tooth stays where it is. So for this condition
Yes.
also, a visit to a dentist is very important. They probably put it
Yes,
in.
because we have to take an X-ray for that, and then if it's at the right point of time, we have to extract the tooth. We ask the children to bite naturally, khira do, radish do, carrots do, anything they can bite on, so that the tooth naturally moves. with the force that the cucumber or whatever is causing it. अगर वो नहीं निकलता है, probably 3 years, 6 months, get it removed from the dentist. We have to remove it. Sometimes its roots are stuck, so it will not remove on its own. Sometimes it happens. The treatments are highly customized, so no two teeth are same in me. No teeth are same like जो मेरे में है किसी और में नहीं होगा. It's just like fingerprints.
Another thing is, by when can you expect that the child should have all the permanent tooth out? Because I also know of
Yeah.
many children who have kind of continued having their middle tooth, 12, 13. So is that okay or not okay?
So first thing is all the milk teeth 20 दांत होंगे दूध के which will be out by their third birthday, 3 years. Then the permanent teeth 28 teeth. 32 दांत, the akaldars are there. The jaw size is decreasing due to evolution. The dinosaur, the gorillas, our chimpanzees, our family ancestors used to have huge jaws due to the food they eat. We are eating the very bad food, so our jaw size is decreasing. Now the akaldars, the third molars, are getting stuck and are coming out. So we will remove it. That is not a concern. So 32 की जगह 28 teeth we need to save right now, and 28 का ही हमें ध्यान रखना है. So the akaldars are coming between 18 years to 25. That is their time period. उससे पहले आपके सारे दांत आ जाएंगे by probably 15 years तक. Because sometimes a lot of tooth takes time to come out and a lot of things are there. But once you do every single visit, even if the doctor is charging 2000, 3000 for a teeth cleaning once a year, I'm just sharing, because kiddos ko thode kam hote hain, but even adults, our phone recharge is more expensive than a teeth cleaning because that needs to be done only once a year.
Also, if you visit regularly, then you are saving the cost of root canals and a lot of others, which are far more
Correct, and a
expensive
lot of
than treatment.
discomfort. Yes,
Yes,
yes.
discomfort number one, because for little children, very, very difficult. And unless they are, very comfortable with the doctor, they will not sit, they will not cooperate. That's very important.
Correct.
One last question I have, Dr. Jasmine, about something which you mentioned and not many parents know about is mouth breathing. You just touched very briefly
Yes,
on it. So if you
yes,
notice
yes.
that a child does mouth breathing, and as a dentist, what can be done about it? Can it be rectified? I mean, is there are some dental procedures which are involving this, or
Yes,
is it
yes,
even
we
the
can.
size?
Yes, if the child is breathing through the night, sometimes it's okay. And at a particular age, anything, all the habits beyond 3 to 4 years is not okay. So you have to keep a watch on it. We have to check the tonsils, we have to check the adenoids, we have to confirm, is it mouth breathing? ऐसा तो नहीं कि सिर्फ parents को लग रहा है and वो बच्चा नहीं कर रहा है. So we have to check that. And these all influence the teeth because the teeth are not in proper functioning once they don't go through the proper development if the mouth is not closed and if they have a habit of mouth breathing. So we have to check the nose, we have to check once with the physician as well. Mouth breathing क्यों कर रहा है? क्योंकि nose से सांस नहीं आ रहा है. So nose में कोई block तो नहीं है. The bones of the nose are fine. So maybe some x-rays are required, and maybe some appliances can be given, ortho appliances to take care of it. It's very simple, it's painless. You don't have to worry the terms that we are using. Just consult and take suggestion. If you want second opinion, third opinion, fourth opinion, no matter how many opinions you take, but don't get worried about the same. If it's beyond 4 years, it's a concern, but 3 4 years pe ab watch rakhna start kar do.
Yeah, that helps. So one parent has shared some images of their child's teeth with me on the chat box, and there are a lot of cavities in there. And I know the child is about 6, 7 years old. So definitely this
Okay.
requires a visit to the dentist. I'll also share those pictures with you on your personal
Sure.
chat. But
Yes, please.
what I can definitely see that if there are cavities in the mouth, this requires a visit to the dentist. Yeah.
Yes, because sometimes, yeah, sometimes बच्चा दूध चाय इतना पीता है. I'm shocked to see it. Kiddos are drinking chai and coffee. So they should not be given till 10 years, I believe. So stains लग जाते हैं. खाना खाते हैं उसके stains हो जाते हैं. So sometimes that is not a cavity. Sometimes that is a stain. So once you visit your dentist, please, before visiting, never on call ask what are the charges. Just say what are the consultation charges or what are the extra charges, because we can't comment on the treatment. आप पूछ रहे हो filling का क्या charge है, but वो filling होना ही नहीं है. Maybe that tooth is fine. So once we share the charges with you, you get worried and you opt for another dentist. Just visit one. Everything It's a health at the end. अब जो भी खाओगे, you have to use your mouth every single day, at least 4 to 5 times a day. So, and swallow. Once you chew your food, chew it nicely. You will see उनको आदत डालोगे 32 times नहीं, अगर chew करना, at least 25 times you chew. Because once you gulp it, the food is indigestible and the stomach has to do a lot of more effort, and then the food is, and then we gain weight. So chew your food in the mouth. That bolus, वो जो बन जाता है mouth में, वो bolus होता है, that the stomach wants. That is the what the stomach is expecting. But we are giving him raw food because we are not chewing it properly. So that is something also that's very important.
True, and I see a lot of young children, even if they get older, parents still continue with the bottle feeding for them. And I think that is also one thing which needs to be stopped because that also leads to a lot of cavities. They, continue the bottle
Correct.
at night.
Correct. Bottle feeding, nursing bottle carries are very, very common. I'm grateful that you have touched this topic. Even if you're bottle feeding, clean, brush, बॉटल पे है कोई बात नहीं, फीड उसको धीरे धीरे छुड़ाओ, जितना आप उनको ये 6 months 100% फीड, बट आफ्टर दैट धीरे धीरे एक एक दिन कम करो, एक एक दिन कम करो, यू हैव टू रिमूव द फीड एंड शिफ्ट टू द बॉटल और वॉट एवर, देन जो भी आप माउथ में ले रहे हो, यू कांट हैव फूड इन योर माउथ द एंड ऑफ द डे बिफोर स्लीपिंग, यू हैव टू क्लीन, सिंपल.
I have a query regarding what toothpaste. You've already said below 3, you'll share a link with us, but
Yes, I
beyond
will share
3
it with
years,
it so that you can directly share with. Yes, yes,
and
yes.
children
I
who are
will
above
directly
3
share.
years of age, for that you'll have to visit the dentist once and check what would be the right.
Correct, because every toothpaste is different for everybody. We have to check the gums in the teeth or what is the requirement of the teeth at that particular patient. So we have to suggest in that ways. एक generalized toothpaste क्या रे sensitivity होती है, अरे charcoal use कर लो. These are just trying वाला toothpaste. Never use miswak, never use Dabur Lal, never use powders, never use Patanjali for kiddos. I'm shocked people are using Patanjali for kiddos. We don't have anything with these brands. It's just that उनका particular size बहुत बड़ा है. So अगर आप बड़ा पत्थर जमीन पे घिसोगे, जमीन जल्दी घिसेगी. आप smaller particles जमीन पे घिसोगे तो वो शायद 100 years लेगा. So we just have to do that. घिसने का काम तो दोनों ही कर रहे हैं. But never use a toothpaste like this. Please visit your dentist. Know the right toothpaste.
I think that almost, kind of covers everything. If anybody still has anything else, then please let me know. But I don't see any questions coming because I think you've touched everything very, very, very nicely. And some takeaways which I have definitely, I can't, thank you for it. Once which you said spitting out the toothpaste, not rinsing. Because
Yes,
yes, kids
yes.
have been taught to rinse your mouth, 6 bar, 10 bar, kitne bar.
Correct. And kids are taught through the parents, and parents were never taught through their parents. So this has to change. This cycle needs to break so that their kids can be, taught the right brushing technique. It's simple. Sleep mouth में मीठे के साथ नहीं सोना. Once a visit a year to the dentist with a cleaning if possible. That's it. You are taken care of. And the right brushing technique with the right toothpaste. That's it. You are done for the life.
Yeah, so this is the mantra which I take back. Once a visit, dental visit for everyone. Very, very important. And go
Correct.
for a cleaning, even if it's your little one, because that's going to save. And what you
Correct.
said is very true. Most of us don't know how to brush the teeth. So we don't end up teaching our children how
Correct.
to brush. And even if we are
Correct.
doing, certain portions of our mouth are not cleaned by the brush. And
Correct.
definitely that needs a visit by the doctor. And one visit to the doctor
Yeah,
is going to save so much discomfort and so much other treatments, and that would be
correct.
far more expensive than the visit to the doctor.
Yes, yes. And yes, never use a toothpick. There comes a floss. That link also I will share with you. वो धागे वाला floss नहीं, because that is a technique that all cannot learn. वो एक floss आता है with a handle. It's like 100 pieces and 80 rupees. That always you use. But in a particular way. वो floss ऐसे ऐसे जाना चाहिए, and this should be the movement of it, up or down, whatever. ऐसे 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 ऊपर जाएगा और ऐसे ऐसे ही बाहर आएगा. So that floss is very good. Never use a toothpick. You are causing more trauma to your gums if you use a toothpick. Toothpick are just for picking up the paneer tikka or mushrooms, but it is never used in the mouth.
True, very, very true. So I'll await, the links which you're going to be sending. And also,
Yeah,
if you have
sure. I'm
any
just sharing with the
interesting,
next.
sure. If you
Yeah,
have any interesting content on your Instagram also, and if you would like to share anything, any link of that, I will
sure,
put that also to the, to the link
sure, sure, sure.
because I'm sure everyone's going to enjoy. And also, if anybody wants to consult you, you are at Noida, right? Am I correct?
Yeah. Noida.
So if you would please, they can DM you on Instagram. Is that okay? Is that the possibility?
Yes, please. Or you can give the same number that we have talked on.
Sure, sure, definitely. We would love to do that. Thank you so much, Dr. Jasmine.
Thank you so much, ma'am.
It was
Thank
really a
you.
pleasure. It was really, we look forward to having more interesting sessions with you.
Same here, same here. Happy healing and every smile is beautiful, but I hope you guys make your smile healthy as well.
True, very true. Healthy smile, once a year visit to the dentist
Yes,
and cleaning
yes,
your teeth. Okay.
yes, correct.
Thank you so much. I'm going to stop.
Thank you so much. Grateful. Okay.